Hi everyone, we are going to discuss the updates to our crash cards to make you better informed and feel more comfortable in the event that you need to use them. We updated the crash cards to align with the system. It is best practice to align our crash cards system-wide to provide a standardization of care. Staff that travel between facilities will be familiar with the layout of the crash cards and be able to quickly provide medical interventions to promote positive patient outcomes. System alignment of crash carts also promotes resource utilization by removing medications and equipment that were not being utilized. Standardization of the crash carts also reduces medication errors and increases medication safety practices. For example, no matter which crash cart you get into here at the hospital, the dextrose pushes will always be in blue cartons. The updates to our crash carts include an entire pediatric tray in the emergency department in the pediatric crash cart. Previously, there were no meds in the pediatric cart, rather an area in the adult cart with pediatric medications, or the medications could be retrieved from the Pyxis. Within the adult tray, norepinephrine and dobutamine have been removed. However, these medications are available to pull from the emergency department or ICU Pyxis. For both pediatric and adult trays, there are replacement trays in the ED Pyxis. We will discuss the procedure for removal and replacement later in this presentation. In both trays, there are advanced support guides to assist with treatment of patients in a code situation. As a refresher, we are going to discuss the locations of crash carts throughout the hospital. There are 2 adult crash carts in acute care, one in the long hallway medication room and one outside of the infusion rooms in the short hallway. There are 2 carts in the OR area. One is in PACU and one is behind the red line in the OR. There are 2 crash carts in the emergency department, one in each trauma room. There's a cart in the CT scan room. It's in the back corner by the scanner. There's also a crash cart in the stress lab. The only pediatric cart is located in the emergency department in trauma room 2. This is an example of an adult medication tray. You will notice that there is an ACLS guidebook in the tray as well. These will be available in all emergency medication trays. There are anaphylaxis kits in drawer number 3 of the adult crash cart. If you use the medication tray from a crash cart, you should replace the tray with the replacement tray found in the emergency department Pyxis. This picture and the number of medications that will be found in each tray can be found in all of the departments near their Pyxis. Here's an example of the pediatric trays that you will find in the pediatric crash cart and in the emergency room Pyxis. In the event that there would be a pediatric case in the OR, it would be best practice to remove the pediatric replacement tray from the emergency department to keep in case of an emergency. The tray would then be returned to the Pyxis so that the pharmacy could restock. You will notice that this picture has the medications that will be found in a pediatric tray as well as the quantities. There will also be a PALS guidebook in each medication tray. Should you use a medication tray on either an adult or a child, it's important that you restock the code cart with a fully stocked medication tray in the event of a future emergency. You should retrieve the replacement tray from the emergency department Pyxis. You will be pulling the new tray under the name of the previous patient that you used the last tray on. The fully stocked tray will then go into the crash cart. The used tray will be returned to the emergency department Pyxis for the pharmacy to restock. It's important that this is kept in the Pyxis due to medication safety. Once the crash cart has been restocked with a new medication tray and replacement supplies, the crash cart should be secured with a yellow lock tag. You can get these tags from the emergency room Pyxis or the house supervisor. The new lock number should be recorded on the crash cart log. Key takeaway points from this presentation. System standardization is best practice so that we as staff members can provide optimal, efficient care to our patients in their most vulnerable time to promote positive outcomes. It's important to know your crash cart locations on your unit and that there is a pediatric crash cart located in the emergency department only. You should familiarize yourself with the medications available in each crash cart. If you use a medication tray, you must replace it with a replacement tray from the emergency department Pyxis. This alerts pharmacy that the tray needs restocked. Thank you so much.